Welcome to this educational video on how to help your surgical patient quit smoking in the perioperative period. As a major life event, surgery can serve as a catalyst for patients to quit smoking. Patients who have a major surgery are 50% more likely to have a successful quit attempt. With around 10 million smokers undergoing major surgery every year, this presents a huge opportunity for surgeons to intervene. Cardiovascular complications include myocardial ischemia and infractions through several mechanisms that disrupts oxygen demand and supply to the heart. Smoking constituents creates a hypercoagulable state by increasing platelet aggregation. Smoking constituents can increase sympathetic activity, thereby increasing HR, heart rate, and MAP, mean arterial pressure. It reduces oxygen delivery to the heart through coronary vasoconstriction and by carbon monoxide hindering hemoglobin's ability to transport oxygen. It takes only hours for the beneficial CV effects to be seen due to the short half-life of nicotine. Pulmonary surgical complications. The most important pulmonary complication of smoking is pneumonia. Contributing factors include impaired ciliary function and enhanced mucus production. Tobacco's toxins can also impair the lungs' immune system by decreasing pro-inflammatory cytokines and macrophages. Impaired healing of bones and surgical wounds. Studies confirm that smoking is a risk factor for wound dehiscence and infection. Nicotine and CO produce peripheral vasoconstriction and bind to hemoglobin, respectively, both of which are deterrent to tissue oxygenation, an important determinant of wound healing. Smoking constituents can also directly impair function of cells such as fibroblasts and immune cells involved in the process of tissue healing. Generally, the rate of wound-related complications in former smokers is like those who have never smoked. A framework approach designed for physicians to help their patients quit is called the 5A's of smoking. It consists of ask, advise, assess, assist, and arrange. In this video, we will teach you how each element of this model can be tailored for surgical teams to help your patient quit. Ask. Inquire about tobacco use even if you already know the answer. Your advice should be strong and personalized to have an impact on patients' smoking habits. Put an emphasis on the benefits of abstinence on mitigating perioperative complications and the long-term benefits of quitting. Use what you learned about smoking-related complications in surgical patients to deliver such strong and personalized advice. Assess readiness to quit. Many surgical procedures are recommended to have a period of perioperative abstinence. This can be, for example, a 12-hour abstinence prior to surgery and 1 week after the surgery. The rationale is to allow for the dissipation of CO and nicotine prior to surgery, and its absence after the surgery to allow for wound healing to progress. If the patient is not ready to quit completely, encourage for earlier and longer perioperative abstinence for a better surgical outcome. Assist. There are many ways you can assist your patient in their journey to a tobacco-free life. This includes both behavioral changes and pharmacotherapy. Pharmacotherapy. Nicotine replacement therapy, or NRTs, utilizes gums, lozenges, and patches as delivery systems. Other options, such as bupropion or varenicline, can augment NRTs. Bupropion is an antidepressant intended to reduce tobacco cravings. Varenicline, Chantix, is a nicotine receptor agonist. It is intended to diminish withdrawal symptoms and reduce cravings. Behavioral support is the second major component of helping patients quit. This involves having conversations centered around removal of tobacco products, managing and avoiding triggers, mobilizing or creating social support. Another way to assist your patient is by referring them to 1-800-QUIT-NOW, where they can work with an experienced QUIT coach through phone, online, or in-person coaching. Arrange a follow-up. Most surgical patients will be seen by their surgeon post-operatively, providing at least one automatic follow-up opportunity for the surgeon to inquire about the progression of their cessation journey.